A steady stream of mostly wealthy Nigerians have continued to patronize foreign medical institutions in a bid to solve their health-related problems. This resort to foreign medical relief is seen by many as one of the surest ways through which Nigeria loses money that ordinarily should have been invested in supporting domestic health care. In recent times, however, a number of Nigerians have been trying to reverse this worrying trend. Some of them going on to invest heavily in state-of-the-art medical facilities with multifunctional dimensions in the country, or with the exception of none, are however situated in the major urban centers. We are now being joined by Dr. Godwin Maduka, a Nigerian-American anesthesiologist who has taken this crusade against medical tourism to a different level by establishing one of such facilities in his village in Anambra State, southeast of Nigeria. He will also be talking about his involvement in the fight against COVID-19, as well as the confused situation with the 2020 United States presidential election. Dr. Maduka, good morning, and thank you for joining us on the morning show. Hello, Dr. Maduka, can you hear me? Yes.
Good morning.
Welcome to the morning show. Well, very
yes,
quickly.
I can hear you. Thank you for having me.
Yes, Dr. Maduka, one of the major issues in Nigeria is medical tourism. The foreign exchange that we lose with our leaders going abroad to treat stomach ache, ear ache, tunu. What is that other popular things that our leaders go to treat abroad? But you have taken the initiative to set up a medical facility in your village in Anambra State. Now, what motivated you to do that? And how viable do you think that that enterprise will be? Even now that all of us are locked down here, even the ones who go to the US, to elsewhere, to treat themselves, they can't go because Europe is down with COVID-19. So we are all here together. So just talk to us about that facility that you have set up, where it is in Anambra State, and why you think medical tourism is an issue that needs to be addressed.
Thank you very much. Being born in Nigeria, grew up here, and in my 20s immigrated to US and did chemistry and pharmacy and medicine and ended at Harvard and seen a lot of what is going on. Most of us have been victims of medical tourism. Some of the patients, by the time they get to India, UK, America, either they die in transit or they die few years after such a major operation. I knew that we can't keep going on that way. One of these things that motivated me to read medicine is that when I was growing up, most of the medical care were provided by native doctors, one of who was my father, one of the renowned native doctors that were curing anything from infectious disease to infertility to even mental illness and malaria. So having gone to US and seen what is happening here in my home country, I knew that this can't keep going on. For how long will it go on? With a population of more than 200 million. So that's why I began to see what I can do as an individual. Now, we finished building Trinitas Hospital, which is a full-fledged hospital from surgery to maternity to internal medicine to general care. After doing that, and is an operation, very well equipped from US as well as Germany and India. It's a state of art. It's called the Trinitas Hospital in Umuchukwu, Anambra State. But there is this thing where you have to have a medical development teaching fellowship, which is necessary, medical education. That's why I embarked for 20 years to build that 17-story medical institute. It took about 20 years to finish, and we're still on the road now to equip it and start training medical doctors, having an area of oncology, diagnostics, and radiology, every aspect of medicine, and especially care. It's not for every type of illness, but this will provide us opportunity to train Nigerian doctors so they can stay at home and don't have this brain drain. So that's what motivated me, and that's what I'm doing now. Thank you.
Well, we should thank you for what you're doing. It's really ambitious. I want to talk more about your Institute for Medical Research. Can we talk about what lapses that have been exposed by the COVID-19 pandemic that institute can help correct? Specifically, we saw with the international lockdowns a disruption in supply chains and real fears about importation of drugs. Nigeria would have been in quite a perilous position if that lockdown had continued. How are you addressing this? Because I know you're also a pharmacist. And also with the COVID-19 vaccine and that whole race, Africa has really been left out of the conversation, apart from South Africa and their one university of Witwatersrand, which is trying to conduct vaccine trials in conjunction with University of Oxford. Beyond that, the only part of the conversation that Africa has is some kind of a footnote. The discussion is, oh, don't forget the poor, struggling countries in the race for a vaccine. How are we going to donate vaccines? Which is really quite unfortunate that we find ourselves in this position. How will institutes like yours resolve some of these problems?
Thank you very much. It is interesting to know that we had more pandemic problem than even COVID-19. I mean, we have malaria that have been ravaging our continent for generations. And up to now, we don't have a hold on it. So this motivated me to get into this medical research, which will house expatriates from different countries and from the developed world. It is time that Nigeria pay attention to medicine and to protect ourselves. So this medical institute came in time when COVID-19 showed up in our land. So with this medical institute, we will study viral infections, bacteria, parasitology, parasites, and things like that. And so we will be in a cutting edge with the rest of the world. I repeat, there's no need for us to lag behind from medicine or technology. They have the same brain as we do. Having studied in the Western world, I have realized that the difference between people is exposure. Expose our doctors, our youths, to learning things that are needed to help this country. So the Medical Institute, should there be any other pandemic, which you cannot avoid, but we hope it's not anytime soon. I hope by the time we're done, we'll be ready for it. So it's still going to be a conversation between countries and between different medical communities, from Germany to US to UK. No country can have the answer, but we should be able to be dependent on our own understanding and our own studies, and so that we'll have to be able to bring those equipments or medicines that are needed to curb the increasing number of infections. As you know, I have a doctorate degree in pharmacy and pharmacology. It's a time that we start building our own factories that produce our own medications. If we can't come up with our own medication, we can also import raw materials and we assemble them here to save us from those medications that are faulty and be manipulated. So having the pharmacy and factories that produce medications, even the ones that is here in Nigeria, and having the hospitals that can train doctors and be able to bring expatriates from overseas so we can exchange ideas. All this Western world, that's all they do. They exchange from Australia to America to UK. even as far back as Cuba. They exchange ideas. We need our doctors to go to the lab and also do their own studies that is inherent in our country. So that's what I think, that by the time the next pandemic episode happens, that we Nigerians should be ready, both home and abroad, and the federal government should really think twice about investing in medical education and development in this country. Thank you.
Right. I mean, very mean feat. 17 floors hospitals, you've stated there in your village, and to train a lot of doctors. I mean, with what you've done, you remind me a lot of an Indian doctor called Dr. Devi Shetty that helped in democratizing open heart surgery in India, that created a scheme that made it very affordable for farmers to be able to get open heart surgery. I want to talk about cost. What's going to be like the cost? Will a common man in Nigeria be able to afford, your medical services for these illnesses, or you are going to employ the help of insurance companies and they're going to, determine insurance packages that you are going to use? And somebody will have thought, what's the accessibility to your village?
Thank you for that. I mean, I might answer this question in different ways. Let's just talk about the accessibility to my village. My village is no more a village. It's an urban town right now because we have motorable roads, we have all the amenities needed, we have the housing, and we embarked over 20 years now, making sure those infrastructures are in place. So, I mean, we are in the neighboring town, neighboring city, in the border of Abia State, Enugu State, and Anambra. So that stands to help the southeastern Nigeria. It's not one of those places you have no access to. And to be able to develop this level of medical infrastructure, we have to make sure that we have a motorable road and places, and people, even expatriates, can live in there. We have all those structures in place. That will help them to come in there. And in terms of, go ahead. In terms of what we're doing in, yes, because I'm actually trying to recollect the rest of the question.
The cost to the common man. The cost of it to the common man.
Thank you. Listen, excellent. We Nigerians have to figure out what helps the Western world. I came from a medical background where we have Medicare and Medicaid. And we have enough money to have that kind of insurance scheme where the people that are underprivileged should have access to health. If you can't take the health of your country, I don't know what else you're going to do. And in terms of being accessible to the community, of course, it's a high-end specialist care. The kind you might not provide in any teaching hospital here. So most of the ailment, most of the patients will go to the indigenous hospital that provide all that, which is not accessible to everybody in that town. So this is more or less a teaching institution with a critical care background that will be in there, diagnostic department, oncology, cancer, cardiovascular diseases, open heart surgeries, and we do know that Nigeria is one of the highest, one of the highest rate of prostate cancer. So the diagnosis of prostate cancer for men, the diagnosis for breast cancer for women, that would be good. So this is a specialist care which is accessible to the people that meet that specialist type of treatment. In terms of being accessible to them, there will be a scheme that they will benefit from. but most of the ailment will be dealt with by hospitals.
Dr. Maduka, I would like to commend you for the great work you are doing, your patriotism, your attempt to give back to society. But, you know, we've seen many examples like this. People coming from the U.S., they come and set up something in the village. And meanwhile, at the end of the day, they have their own plans. Do you have a certain plan that we don't know? Are you planning to go into politics in Nigeria? And this is the first step in that direction. Or this is just plain altruism?
All right. Okay, thank you very much. Let me make it categorically clear. Politics is an afterthought. Okay, having grown up in Nigeria in my 20s, immigrated to USA, I had that opportunity to get an excellent education, but I still left some people behind here in Nigeria. I'm not here to benefit from helping my people down here. I am here to trying to see what I can do, which, as most people know, I've been calling all the Nigerians in diaspora, very intelligent, educated, and many people that are in different areas of endeavor to come back home. Now, I've been doing this for more than 20 years, which is more than 2 decades. It would be nice to come and set it up and go. This is my home. I would rather be here than be overseas. Everybody has to look like me here. And our people need to get to the point where we, like every other country, we should be dependent on ourselves, get assistance here and there. As a sovereign nation, we shouldn't be depending on the other sovereign nation to provide our health care. Okay, what will make us believe that we are created equal with the rest of the world? So my answer to that is that I started doing all this. Part of the reasons that I'm my endeavor into politics is to help me as an individual to push forward some of these ideas and agendas that I have at hand, so that I won't have any pushback. This idea of politics is to be able to help push forward some of these agendas. And I'm here to stay. I'm not here to set up and go where.
Thank you very much, Dr. Godwin Maduka, and welcome back home. And thank you for giving back to your community and your country. Thank you.